Tourette syndrome is a neurological disorder characterized by physical or vocal tics, which can either be simple or complex. Estimates from the Center for Disease Control show that 1 in every 360 have received a diagnosis of Tourette syndrome. While some tics can be extreme, such as self harm or shouting of profanities, most cases of Tourette syndrome have more subtle tics. These can include involuntary blinking, shoulder shrugging, throat clearing, or even grunting sounds. Teaching a student with Tourette syndrome can seem daunting, but with knowledge and training surrounding the disorder, a student with Tourette's can potentially fit well into a general education classroom. Having a working knowledge of the disorder and understanding its challenge can help your students succeed. The first thing that a teacher should know about the disorder is that a student's tics are entirely involuntary. While some tics may be more disruptive to a classroom than others, the student has no control regardless of the severity. The second thing that a teacher should know is that tics can vary in their extremity and can change as the year progresses. Just when you may feel comfortable helping your student manage their tic, there can be an entirely new tic. The third thing that a teacher should know is that the student who has the tic is likely embarrassed by the action and the unwanted attention that it draws to the individual. Ensuring that your classroom and students don't react can help your student feel most comfortable. The fourth thing that a teacher should know is that tics are not always as extreme as the common perception surrounding the disorder. While Tourette syndrome can evoke images of shouting profanities, self harm, or other extreme actions, most tics are rather subtle. The final thing that a teacher should know about Tourette syndrome is that stress and anxiety can make a student's tics worse. A student with Tourette's will likely do better in a calm and relaxed environment where they're able to feel comfortable. All of these things are important to understand surrounding Tourette syndrome and help to lay a foundational knowledge to ultimately better serve your students. These key points, combined with specific teaching strategies, can help your students thrive.
Fortunately, there are various strategies and methods in order to better manage the disorder. Tics are categorized in two separate groups, motor and vocal. Motor tics are typically more common and consist of physical movements. Some of these physical movements include jerking the neck, eye blinking, finger movement, tensing the muscles, and could sometimes be as severe as hitting. On the other hand, vocal tics are described as sounds uttered unintentionally. This commonly concludes grunting, humming, snorting, hissing, and growling. Complex vocal tics may involve words, phrases, or even sentences. The solution that children and adults search for in order to minimize the disturbing effects that come along with Tourette syndrome may vary in motor tics and vocal tics. One technique that has proven to be very successful in efforts towards removing some motor and vocal tics is behavioral therapy. Behavioral therapy helps people with Tourette syndrome to manage and better understand their tics. On top of techniques practiced outside the classroom, there are plenty of in-classroom strategies educators can implement in order to guide one with Tourette syndrome to success. It is very important that you educate the other students on the disorder because the typical student would not understand the severity and could use it as an excuse to be harsh. Making sure you provide a safe place and grant the student with Tourette syndrome the space they need is very important. Anxiety and embarrassment go hand in hand with Tourette syndrome, and most sufferers desire personal time to regenerate or feel comfortable. Knowing your students and what flares a tic is conspicuous, so you can implement specific teaching plans in order to execute your lesson, knowing how to adjust if there is an outbreak or reaction. Lastly, an effective teaching method that can be helpful to both the student with Tourette syndrome and the educator is providing notes for a student who suffers from tics. This provides them with the material they need and gives them the opportunity to not have to stress in a classroom setting when they have an active tic. And although it is not a teaching strategy, the number one use regarding managing Tourette syndrome is medication. They assist in bettering everyday life in the people who suffer. This is not always the best route for some due to the fact that the medications that are provided could have side effects like weight gain, fatigue, or stiffness of muscles, but a lot of sufferers consider it.